So I rolled on in here. I'm in one of the treatment rooms, and I just want to make sure if you are at home watching this, you know that we've got Emmanuel here, and we are giving an idea of exactly how this procedure would go. Normally, Dr. Louwers, you would have on a mask, but so we can see your mouth moving as you're talking.
Right.
We ditched the mask for right now. So let's first talk about the treatment that you do in this room and how it's effective.
What we're doing today is a neurosympathetic reset, and we do it under ultrasound. That way we can do it very safely and effectively. With traditional therapies like talk therapy and medications, often effective, but this uses a very different approach to treating those conditions. So the way it works is many patients that have been through traumatic conditions have an elevated fight or flight response. That's the part of our nervous system that responds to stressful conditions. Like if we're in the woods and we hear growling, what happens? Heart rate gets going, your adrenaline gets pumping. In that scenario, it's healthy, but if that continues, it can be very unhealthy. And it's what contributes to anxiety disorders and PTSD. And our procedure blocks that part of our nervous system temporarily. And even a temporary block of that part of our nervous system allows months to years of benefit from those triggers. The treatment itself's been around for 100 years to manage certain types of pain, but only recently it's been utilized in this way to help mental health.
So show me how it works.
Sure. So right now I'm taking a look at the patient's neck with the ultrasound. These are live images of his neck, and I'm looking at the anatomy. I'm looking at the blood vessels here, the carotid and the jugular vein. I'm looking at the bone, and just between those structures is the nerve, the stellate ganglion, or part of the sympathetic chain. It's our fight or flight system, and that's the nerve that I'm targeting with this procedure. I'm going to use this picture in real time to guide that injection right down to that nerve. So that way it can be done very safely, effectively, and it's a very well-tolerated procedure.
Wow. So about how long does this process take?
So the procedure is pretty quick. It's really only about a 15 or 20-minute procedure. The patient would recover for about a half hour after and be able to go home after that.
How often would we have to come in?
So that's the great news. The vast majority of patients that we're seeing are getting benefit that is lasting months to years.
Wow.
Many of them don't need to come back for a second treatment. They can utilize this to address their triggers and then be more effective with other conventional treatments like talk therapy.
That's amazing to hear. I would not honestly have expected that. And I think the big thing is too, you do not need a doctor's referral.
That's correct. A lot of patients don't even realize that they are suffering with anxiety disorders, that they have PTSD. So if they go online, they take our free assessment, they can see if they qualify. Someone from our office will contact them.
Dr. Louwers, thank you so much. Patient, thank you so much. I appreciate it. You did good for us. And I love just being able to see how this stuff works, because sometimes you don't get that. Again, tell us where that website is so we can get more information.
TheResetCenter.com.
Wonderful. Thank you so much. Reset Medical and Wellness Center right here in Strongsville. We'll be right back on CLE Weekend.